first thing we notice is a lump. Is a lump, and a lump in the breast. And once you see a lump, you have to come to the hospital. If you're not sure, you have to come to the hospital. We assess it, and then we'll know whether it's malignant or it's just a benign lesion. You can also see a change in the size or the shape of your breast, a change in appearance of your breast, especially the skin. There might be skin changes like redness. You might see the skin pitting a little, or you can see dimpling, like sort of goes inside. It's like the skin is being pulled into or towards where the lump is. So we call that tethering. It looks like the breast looks like an orange peel. You see how there are holes in an orange peel. It looks something like that. There's also nipple retraction. That is when your nipples, instead of the nipples coming out, being pointed outwards, you see it inverted. So all these are a sign of a breast lesion, or should prompt you to visit the hospital for further check. And most of the time when the breast cancer advances, you would see an erosion of the skin, like the skin, you see a sore on the skin. And that is a sign of an advanced breast cancer. But like I said, most of the time, breast lumps are not cancerous. But to be 100% sure, you need to visit the hospital so that will be checked and then further investigations done. So there's also the need for what we call the self-examination of breast or regular screening, because these are what will help us detect a lump early, and then we will be able to take the necessary steps. When you come to the hospital, normally we have a series of examination or physical examination and investigations we take you through. First of all, we will have to take a detailed history, including your family history and all that. We do the BMI, body mass index, to see whether you are overweight and all that. And then we would also have a physical examination of your breasts to detect any lumps and all that. And then the next one, when we find a lump in either of the breast, we request for imaging studies, that is the ultrasound or a mammogram. So usually we request an ultrasound scan for women who are below the ages of 35 years, because for them the breast tissue is more dense. And then for those above 35 years or those with nipple discharges, we might order a mammogram for them. And then we also, if we are able to take out a lump or tissue from the breast, then we send it for biopsy for histological studies. So for breast cancer treatment, there are a lot of modalities, treatment modalities. We have surgery, we have radiotherapy, we have chemotherapy, we have hormonal therapy. But all these modalities depend on the stage at which you present. Most women come to us when the breast cancer is advanced. But when you're able to detect it early, most of the time surgery can take out the lump or the cancerous cell for further investigations. So for surgery, we have both the conservative surgery, which removes just the lump in the breast, and then we have the total mastectomy, where we take the whole breast tissue out. And then we also have what we call the lymph node clearance. So actually the lymph nodes are where the drainage takes place. So if there's any cancerous cells, they can be drained through the lymph nodes and then spread to other parts of the body. So once we detect that, we have to remove those lymph nodes to prevent the spread of these cancerous cells. We also have the radiotherapy. For radiotherapy, we use that to reduce the risk of recurrence in the breast and also the surrounding tissues. And then we have the chemotherapy, where we use medications. Sometimes these medications are used to downgrade the tumor. For example, to decrease the tumor in size so that it becomes operable. And then we have the hormonal therapy as well. So for treatment, cost is about 10,000 thereabouts a year, I think. But then I know the National Health Insurance Scheme is supposed to cover treatments for both breast cancer and ovarian cancer, cervical cancers. But then, as usual, there are challenges. And I know different hospitals have different protocols when it comes to national health insurance covering treatments for breast cancers. And these include shortages of the drugs, lack of reimbursements from government and all those. So most of the time, most patients are they put the bills themselves, and it's a problem. But then there are also NGOs available that sometimes help with these treatments. But then the NHIS, I know, covers the consultation and diagnosis, some basic labs, some medications, that is if they are available. And this treatments can actually pose a huge burden on both the patient and the family. But there are NGOs also available who sometimes help cushion these patients with the treatment. But another challenge with treatment also has to do with most patients presenting late when the breast cancer has already advanced to the late stages, where you see a sore in the breast and all that. And such instances are due to patients seeking these herbal medications and all that before visiting the hospital. And I know most of the time, most people do that because of the cost of treatment. So we need to know that NHIS is NHIS covers, or let me say, it's supposed to cover for the treatment of breast cancer. But depending on the hospital you find yourself, maybe it might cover some. It won't be that comprehensive. It might cover some, but not everything. And also, when it comes to surgery, I know sometimes the anesthesia that might have to be footed by the patient or the family. Yes, so I think at this point I would pause for some questions or any concerns that would have to be addressed.
Please, if you have any questions, anything, please, you can raise your hands you can raise your hands for us to give you the opportunity to talk. But wait, me, I have a question, Dr. Joyce. So how does this cause the death of someone? How does breast cancer cause the death of someone? Like, how does, we always hear that breast cancer is killing more women. So how is it killing them? What's the cause for that?
Okay, so like I said, once the cancer cells start spreading, okay, it can spread to your lungs, it can spread to other organs. And once it spreads to your lungs, obviously, you know what is going to happen. It can spread to your liver, your kidney. It can spread to basically almost every organ. Some people, it can spread to their spine. Okay, so you have this back pain and your bones become affected as well. So usually is the spread to the other parts of the body or other organs that cause that.
Hello. I don't know how to raise my hand, but I would like to speak.
Oh, please, you can talk. Just feel free.
Hey, hello. Yes, can you hear me?
Yes, we can.
Okay, I would like to ask Dr. MacArthur for her presentation. It is good. And my question is, what are the myths or what are the non-factual information about this issue of breast cancer? Myths, I mean those things that people believe that they are either true or not true about this issue of breast cancer. I'll give one example, being said that sucking is good habit that might reduce the cancer risk. I will ask that is this true or what? And if it is true? What are the other myths like this? Thank you.
Dr. Joyce.
Okay, so yes, one risk factor for breast cancer is non-lactating mothers. Like I said, the ducts and the lobules produce and store the milk. So once you give birth and you don't lactate, you don't breastfeed your baby, it's true that can put you at a risk. And one myth we have to talk about is people thinking allowing your husbands or boyfriends to suck your breast can prevent breast cancer. That is not true. That is not true. It's rather breastfeeding. Breastfeeding that helps prevent breast or reduces the risk of breast cancer. Another thing, people say putting on bras with these metallic wires can also cause breast cancer, but as of now, no research has proven that to be true. So that one is just a myth. Putting on bras or not putting on bras have no correlation with breast cancer whatsoever. And also, we have people who have never given birth. That can also be a risk factor for breast cancer. That is because those people, it's like your estrogen levels are always high. Like I said, estrogen and progesterone, it's a cyclical change. Whilst estrogen is high, progesterone is low. Whilst progesterone comes up, estrogen, so they are always in a balance. But if estrogen is high all the time, then it means it's promoting the growth of these ducts and lobules. And once their growth goes out of hands, they can become cancerous.
Please, there is the hand up. Hochicho Jackson. Please, you can speak.
Good evening.
Good evening.
Yeah, I would like to use this opportunity to thank the presenter for the information she's giving out. But I have two questions to ask. My concern, the first one is about cancer being genetic. I want her to throw more light on that, knowing very well that most of the cancer issues we have are emanated from physical carcinogens, and then ultraviolet ray, etc. And the second question is, I want to know if men can also experience breast cancer. That is my question. Thank you.
Okay, so first of all, with the genetic inheritance, like I said, there are these two genes. We call them the BRCA1 and 2 genes. They are genes we inherit. And once there are mutations in these genes, that's what predisposes you to breast cancer. So that is it for the genetic inheritance. So if you inherit these genes from your parents and these genes become mutated, then it puts you at risk for breast cancer. And to your second question, when I started presentation, I think I made mention of that we have about 0.5 to 1% of males who are also predisposed to having breast cancers. It's very rare, very, very rare in males. Probably because women, we go through this cyclical changes, and we have this mammary glands that produce the milk and stores the milk and all that, with this hormonal balance issues and all that. That doesn't mean it never occurs in men. It can occur in men, but it's very rare. It's about 0.5 to 1% of the population.
Wendy, please, your hand is up.
Hello, good evening.
Good evening.
Please, I heard doctor was saying, talking about founding. So I wanted to find out how can one assess the founding, because some of the aged, because they cannot afford the treatment, when they refer them, they will just go back home and go and use herbs on the condition. So I wanted to find out how can one assess the founding.
Okay, so with the funding, it differs from hospital to hospital. Some NGOs have their contacts with the surgical departments of various hospitals. So once you are diagnosed or treatment is required and you can't afford, the problem is most patients don't talk to their healthcare workers, you see, or healthcare providers. If you are having challenges with treatment, the best thing is for you to communicate it with your healthcare provider, and then we give you the options. You get, but once you are told, oh, we might you might require surgery, or you might require radiotherapy, or the first thing that comes out, oh, I don't have money, I want to be discharged. You get it? So it differs from hospital to hospital, but then most of the NGOs have their contacts with the hospitals. So once you voice out your concerns, I'm sure your healthcare providers will lead you onto, or give you their contact, or try and contact them for you. With UCC Hospital, we don't have an oncologist or all this. So once we detect, we refer you to the Cape Coast Teaching Hospital. That's where we have the oncologist and the specialist for treatment. So once you get there and you talk to them, they can link you up with the NGOs.
Okay, thank you very much. But this in some village, because I know an aged woman in Takwa area. When she was diagnosed, she was referred to Ekwe Hospital. Then they did some blood transfusion. It was in the beginning. No, the children says they cannot afford it. So the woman is in the house, about 85 years, and they are smearing helps on the breast, and I think the condition cry is even aggravated.
It's getting worse. Oh, that is the problem we have now. And most of the time, usually when, like I said, when they present at the late stages, sometimes it's just about palliative care. It's like now the cancer has spread to almost all the organs, and there's practically nothing that can be done about it. So we call that the palliative care. So you just try to make the patients comfortable till the inevitable happens. So most of the time when they come with the sores and all that on the breast, with back pains, fractures and all that, then it means the cancer has already spread. So I'm sure it has to do with just the palliative management. And for palliative care too, obviously, in Ghana, we don't have much of those palliative facilities. So they just send the patient home to, it's not the best, but hopefully going forward, we'll have such facilities that can at least make life comfortable for them till the inevitable happens.
Okay, so we have another hand up. Dora. Dora, please, you can bring up your question or suggestion.
Okay. Good evening to all listeners, and thank you very much, Doctor, for the presentation. I would like to find out about the challenges that survivors face after treatment, survivors of breast cancer face after treatment, and what resources are available to help them reintegrate into their daily lives.
Okay, thank you very much for the question. Most of the very first challenge has to do with recurrence. So having breast cancer before puts you at risk for another breast cancer. So most of the time, it's that is a major challenge. And also, like I said, sometimes treatment, the cost of treatment can also drain the person's coffers and all that. So now after treatment, it becomes difficult for the person to go back to work, or probably the person took some off days and all that for treatment, and the treatment itself can really drain a person, especially when it comes to this chemotherapy and all that. It really drains the person. But I know they have these support groups and all that in the hospitals for such survivors or patients with breast cancer and all that, and they meet and try and help each other, and also to help reintegrate them back into their communities.
So without any further questions, I would love Dr. Joyce to continue with her presentation.
Okay, so the next thing I would like to talk about is breastfeeding. Breastfeeding. Okay, so when it comes to breastfeeding, whilst I was giving the earlier presentation, I spoke about non-lactating mothers being at risk for breast CAs. So we advocate for mothers to breastfeed their children for at least 6 months. And this doesn't only benefit the mother or the child, but it also helps when it comes to the health of both mother and baby. So sometimes we might say, oh, I'm not producing enough breast milk, so I would want to complement it with other feed. But then one thing we fail to realize, the more we breastfeed the baby, the more we produce the milk. Most of the time, within the first 24 hours after birth, it's very difficult for some women to start lactating. But then the more you put the baby to breast, the more the mammary glands produce the milk. So some people usually in the hospitals, we ask them to get some formula feed for the baby, which actually is to help the baby so that the baby doesn't go into hypoglycemia, because they also need to eat. But then some women actually after that kind of continue with the formula feed, and that becomes the option for the baby. But then once you are giving the formula feed, you also need to continue breastfeeding, and baby is supposed to be put to breast at least every 2 hours, such that the mammary glands will be stimulated to produce more milk. And also about breast hygiene, like I said earlier, and the theme for the program, bras being your best support system since childhood. Every woman uses bra every blessed day, or let me say most women use bra every day. So we should know how to keep them clean. We wash them regularly, and also try and clean our breast, not just during, or not just when we are taking our shower, but at least we have to make sure we clean the breast, especially the fold under the breast, with a clean towel and soapy water and all that. We clean, and also make sure, most people, well, there's no rule about sleeping with a bra or not sleeping with a bra. So far as you are comfortable sleeping with it or not, that is up to us. But then when it comes to the bras, we just have to make sure we keep them clean. And also the myth about the wires under the bra being a cause of breast cancer and all that, that one is not true. There's no research about that so far. So that is also about the bras. And then another thing I would like to talk about would be with the breast self-examination. I don't know if we know, I wish it was a one-on-one meeting, so that at least we would learn how to do that by ourselves, because most of the time whilst we are in our room after shower or in the shower, we can all do this self-examination, and it's really helps for us to detect early whether there's a lump in the breast or not. But even not that notwithstanding, of late we have breast screening examinations every October, which is the Breast Cancer Awareness Month. So once that opportunity comes, we shouldn't miss it. We should try and go to the hospitals so that we would be examined, and then any abnormalities will be picked up early so that we would have early treatment, and then save lives with that. So I think I'll bring my presentation to an end now and take any other questions as well.
Thank you, Dr. Joyce. Please, at this point, I want to also ask a question. You know,
Okay.
with the examination, I heard we
Mhm.
have two types. And then the two types is the one you do yourself, and
Mhm.
and then the other one is the one they use the technology. And
No.
what I heard, okay.
So with the examination, we have, that's what I said, we have the physical examination. That one, it has to do with either you doing it yourself or by a health worker. So that is the one that you put one, you raise your hand and put your palm behind your occiput, like your head, and then you using your forefingers, you try and massage the breast in all the quadrants to feel for any lumps, and then you do the same to the other breast. So for the other technologies, they are the further test we do. So after the physical examination, when you detect any lump, that is when we proceed to the other investigations, where we either take an ultrasound or a mammogram to see what exactly that lump is.
Okay, thank you. And secondly, I'm also looking at is there by any way that the food we eat?
Hello?
Hello, Dr. Joyce.
Yes, please.
Is there any way that the food we eat also causes breast cancer?
Yes. So when I was talking about the risk factors, I spoke about taking in high fatty diets, and we also have taking in excessive red meat. It's it's not just breast cancer, but almost all cancers. We have what we call the carcinogens. So they are in certain foods, red meats, fatty diets, because like I said earlier, when you are obese or when there's too much peripheral fat, they become converted into estrogen, and that can also increase your levels of estrogen and then predispose you to or put you at risk for certain cancers. So yes, our dietary modifications also help us to reduce the risk of these cancers.
Okay, and I also want to know something. You said something about people who have PCOS, also having a high chance of getting breast cancer.
Yes.
So
No, not having PCOS. I
oh,
was talking about hormonal therapy.
okay.
So if you are on hormonal therapy for more than 5 years, these hormones, estrogen and progesterone, like I said earlier, these two hormones are what regulates or they always need to be in a balance. But with certain conditions, for example, PCOS, sometimes to balance your menstrual cycle and all that, we put you on these oral contraceptive pills or other hormonal therapies. So this can cause an imbalance in estrogen and progesterone levels, and that can put you at risk for breast cancer, but not you having PCOS itself.
So I also want to know the myth about it's usually when you're about getting into your menopause stage that you have issues with your breast. I want to know something about that as well.
Not necessarily, because I said for the risk factors, I mentioned the fact that when you have a late menopause, that one rather puts you at risk for breast cancer. That is because instead of the progesterone and estrogen being a balance, now the estrogen becomes more. You get it. You have high levels of estrogen, and this estrogen is what causes the growth of the ducts and the lobules in the breast, where the milk and all those things are produced. So it means you'd have let me say a prolonged period of high levels of estrogen, which puts you at risk for developing a breast cancer.
Okay. And it seems I'm the one asking all the questions. I'll ask this question and then I'll leave the platform for my other colleagues to also ask. Is there by any way climate change has been affected or is affecting breast cancer in a way?
Climate change.
Yes.
Not that I know of, but probably I would say maybe radiations, exposure to radiations, because there are certain areas where there are these rays and all that. For example, certain work environments, all those things, those one can predispose you to breast cancer due to those radiations, because your cells are exposed to these radiations, and that can cause them to start growing out of the normal. So that can put you at risk for breast cancer or other cancers, not just breast cancer, but other cancers as well.
Thank you. Please, at this point, if you have any question, kindly raise your hand so that we could, continue from there. Dora, please, do you have any question?
Yes, I do.
Okay.
My question is about the bra. Since we have bra as part of the theme, so there are myths about bra. So I wanted to find out if there are any recommendations for selecting bras that can provide adequate support without causing any discomfort or potential issues. People assume that the type of bra you wear can also contribute to breast cancer, which of course some people say there are myths. Yeah, they are myths. So I wanted to find out from our experts if some of these bras actually contribute or can in any way cause breast cancer.
Okay, so bra in itself has nothing to do with breast cancer. And for the choice of bra, that one is it's an individual choice. You have to pick the right size that can help support your breast, because we all have different size of breast and all that. So when it comes to choosing of a bra, you would have to know the material that is okay for you, the size that can actually support the breast. Because if you get a size that is too tight, it can cause back pain, lower back pain, waist pains, and all that. And if you get one that is very loose too, it will be very uncomfortable for you. But when it comes to bra and breast cancer, there isn't any research. As at now, there's been no risk. There's been they've done other researches and all that, but they didn't come out with any conclusive evidence that bras contribute to breast cancer.
Okay, thank you very much.
You're welcome.
Hello.
Please, any more questions?
Hello.
Please.
Hello.
Hello, please, we are listening.
Yes, that's Safari again. So I would like to ask again our experts that first of all is about the bra itself. I was just thinking, what if why is it important for a woman to use bra? Like what if she is not using? That's my. The other is about the preventive measures. What could be the preventive measures for this breast cancer, like from intake word, or what type of foods that are maybe preferable so that someone can increase the intake. I've heard about those type of foods which should be at least reduced or avoided. But what about those kind of foods which at least can help someone to reduce the risk of getting cancer? Thank you then.
Okay. Thank you for your question. So for the first question about brass, that's why I said that one is an individual choice. You get it. People don't wear brass and they're okay. Other people too have we don't have this really small or well attached breasts. So we support, so bras are just to support the breast. You get it. So that one, it's an individual choice as to whether you want to wear a bra or not, and the type of bra you want to wear. But then once you are choosing a bra, you should choose the right size. Okay, because if you choose the wrong size too, it will come with other effects, such as the back pain I was talking about. If the bra is too tight, you can have shoulder pain, rib pain, lower back pain. If it's too loose too, the breast becomes saggy and all that. But then there's no rule about selection of bras, or so far as what you choose is comfortable for you, that is fine. And with your second question, like I said, the modifiable risk factors talked about the things we are not supposed to do, or the foods we are not supposed to take. So when it comes to the right food for us to take, at least we should always think about the how do you call, less red meat. We should take in more fluid instead of alcohol, or if we can't do away with it, at least you should take it in moderation, not excess alcohol intake. Taking more of the vegetables and all that, more fruits, instead of the high fatty or junk food. Yes, so those are some of the things. We should also be physically active, exercise more, and also for those who use the oral contraceptive pills, you try and not be on those pills for a long time, because that one can also cause hormonal imbalance and predispose you to the risk for breast cancer.
Thank you
And
very
also, if
much.
you have a family history of breast cancer or cervical cancer, you should be having more screening, like regular screening for breast cancer, at least once a year.
Please, Vice P's hand is up. Miriam Frimpong. Please, you can ask your question. I think we have network issues. So I think she'll join and possibly ask her question later. Please, are there more questions? Because what I'm hearing today is giving me goosebumps. The men that are spreading the news about sucking breast live a life. Dr. Joyce,
Yes.
you have sports market too. Okay, so I think, is there any advice you would love to give us?
Okay, so to end my presentation, I would advise us all to take advantage of this month's breast cancer awareness. And if we've not had a breast examination done yet, just walk into any health facility close by and have your breast examined, because it's free. So let's take advantage of that and then have our breast checked, because early detection actually saves lives. And if we know of anyone with a lump in the breast or any condition of the breast, at least we should try and educate them with the little we've heard here today, so that they can also take the step to seek for medical help. Thank you.
Dr. Joyce,
Yes.
I'm concerned about something. I have realized that of late, most ladies take folic acid.
Mm-hmm.
Yes. Is there any way because I'm scared to take it myself, but people
Mm-hmm.
are saying it's good. Is there any way this can also trigger that?
Okay, so folic acid actually helps with our reproductive health. Okay, but sometimes too, folic acid can, if with certain conditions, it can actually, for instance, when it comes to cancers, sometimes we say it helps feed the cancer. You get it? But for women, folic acid is very good when it comes to reproductive health. That's why also when we are pregnant, folic acid helps to prevent this spina bifida and all that in the developing fetus. So if you don't know about the condition, okay, usually it should be prescribed. You get it? Even though some people take it as a routine supplements. But then once you go to the hospital and we detect anything, usually that's what I say, we take a detailed history. Okay. So once we diagnose any condition that we feel folic acid is contraindicated, would definitely stop that medication.
Okay, so is it by chance, if I'm to say after this October, I'm visiting the hospital for my breast to be examined, am I going to pay for it?
No, you mean after October?
After October.
Okay, so after October, I'm sure, well, most of the hospitals, the general hospitals, would not have those privileges again, but other hospitals still do that. And also we have these reproductive health centers and all that, where all these are free, regardless of the month or day. But obviously for the private hospitals, you would probably have to pay for consultation and all that. But for the public hospitals where they have this reproductive and child health clinics, they still do them for free.
Thank you very much. Dora, I see Dora's hand. Please, are there more questions? Dora, please. Okay.
Yes, hello.
After Dora, then Miriam, please.
A quick one. Dr. Joyce.
Yes.
It seems the men are making it look like it's only ladies who are supposed to be squeezing the day. When we talk about squeezing the day, the men usually say they need ladies to be squeezing for them and all of that. I want you to advise our men here, if if it's possible. After today's presentation, I've learned something, that it is not only women who need that, men also do need it. So I want you to say something small to them so that they get it in their minds that they are to squeeze their breasts themselves. They also need that self examination.
Yes, please. Okay, so for our men, like I said, even though breast cancer mainly is in women, it is also in men. It's rare, but it is in men. So you should also be screening for any lumps or changes in the breast. And you are the best person to do that, because most of the time it's like we are always curious about our bodies and all that. So it wouldn't hurt for you to examine yourself here and there once in a while to see whether there's any lump or any change in your breast. Thank you very much, Madam Dora, for that contribution.
A quick one, Doctor. Please, I would like to know if, as an individual, even after the Pinktober, you would want to be an advocate or you would want to take any measures to spread the breast cancer awareness, there are some procedures that you need to take. Can you just stand up one day and decide to do this, or there are some steps that need to be followed to be able to take up that task?
Okay, so when it comes to awareness creation, you don't really need any procedures or any protocol, depending on your target population. Okay, that would probably you would have to seek an appointment time or day. But then, for instance, if you want to talk to an organization like a church or schools and all that, then you seek approval of the school authorities or the church heads and all that. But then you don't necessarily have to go through, for instance, Ministry of Health or all those things. So you just liaise with whichever organization you would want to talk to, and then
Okay.
yes, you work something out.
All right. I asked this question because there are some initiatives that for you to be able to undertake, you need a license. So that's
Yes,
why
yes,
I asked this question.
yes, yes. Because it's that has to do because some of these health related issues, when you are talking on them, at least you need to have an let me see, a background, yes,
Yes.
and have some background education about that before you can give the right information and get it.
Yes.
Yes.
Okay. Thank you.
You're welcome.
Please, our Vice President has a question. Miriam, please, the floor is yours.
Okay, thank you very much, Rebecca. Please, to you, Doc, I don't know if this question has already been asked, but I want to know. Most often, we ladies tend to repeat our bras for some days before we change it. I want to know that does it have effect on our breast? If yes, then how many days can we repeat our bras? Thank you.
Okay, thank you for the question. We spoke about this earlier. I'm sure by that time you had some network issues. So when it comes to bras, we need to, like I said, we need to keep our bras very clean. And bras have nothing to do with breast cancers, but then it can also cause skin irritations, rash, and all that, especially when you wear them for a long time. Okay, and that also is an individual, individual choice. Let me put it out, because some people, are very active within the day. They sweat a lot. So for such a person, if I work a lot during the day and then I sweat a lot, I would probably want to change my bra every day or every other day. Okay, someone too might just be in an air-conditioned room all day without sweating and would want to repeat her bra. So far as it's comfortable for you, or it doesn't cause any skin irritation, skin rashes, all those around the breast, because obviously that can also cause other conditions to the breast, these benign breast conditions. Also for lactating women, there's this condition we call the mastitis. Okay, that one, it has nothing to do with the breast per se, but then for that one, most of the time when your breast becomes engorged and the baby isn't taking the milk, okay, there can be cracks and all that on the breast or at the nipple, and organisms can go in there and cause an infection. So if you wear a bra, let's say your breasts are engorged and the milk is dripping, your bra is wet and you don't change it like even twice a day, it can grow bacteria, and that can also cause other infections as well.
Please, are there more questions? Dora, please, your hand is still up. Do you have any question? Okay. Please, you have a question. Okay. So, Doc, with this bra issue that Vice President said, and you are bringing up people having infection on their breast. I have checked on someone who actually has had this breast she had a big sore on her breast, and of which you know this things that come out of sore comes out from it. But at the end of the day, she went to the hospital several times and she was told she didn't have breast cancer. And this thing transferred to the other breast as well. But at point, for me, I want to know if this could be cancer, because I am sure they didn't want to examine it because of the sore.
Oh, no, that I don't think it's that wouldn't be professional on the part of the healthcare provider, because once a person presents, regardless, we've seen women come with really huge sores on the, like, to the point where you can actually see the bone, the chest bone. And you still have to examine regardless and run your test and all that, because you can only declare that as an advanced breast cancer, which requires just palliative care, after you've done your due diligence, after you've run your test, after you've done your physical examinations. You can't just look at the breast and say this is not cancer. As for that one, you can't just diagnose with your eye by looking at the sore or the breast and then say this is not cancer. You have to examine, you have to run some tests. And then based on all this, you can diagnose the person. So I don't know how that woman was attended to, or how come they say it's not. Because
Let her come back home.
Pardon?
They made her come back home, and she was using this hot water, this native stuff. At the point, wounds they were healing, but you see that it will come back again. It was on and off. Yes.
Well, has the person been tested, as in had a scan, an ultrasound scan or a mammogram?
That I'm sure the person had, or for me, the person is no more. That I could have asked the person, but the person is no more.
Okay.
I just wanted to have a fair idea if it could be just the infection, or it could also be probably the cancer.
So with the infection, most of the time, the mastitis, it has to do with lactating women. So that one is those who have given birth and are breastfeeding. That's when we will have this mastitis. But earlier on, I also spoke about these benign breast lesions, like the duct papilloma. So that one particular duct or a group of ducts that store the milk become infected. And that is when you see some discharge from your nipple, you feel a lump, the discharge can be bloody or yellowish. With all these, most of the time they are benign, but then it can transform into a malignancy. That is, it can become cancerous. So you have to go for early treatment.
That one has fallen.
So probably it was
It
a
has fallen.
benign
They
condition,
are
but
all
then
fallen.
because she didn't seek medical care early,
We see that that's a
probably
wall at the
it transformed into a cancerous thing. But unfortunately, the person is no more, so we can't actually follow up and see what's actually happened.
Please,
But
there's
that's
also
the thing.
a myth that people with bigger breasts tend to have breast cancer more than those with a smaller breasts. How true is it?
Well, I don't think that is true. I don't think that is true, because size is not a risk factor for breast cancer. If size were a factor for breast cancer, then men would never have or will never have the risk factor for having breast cancer as well, because they don't have big breasts.
Okay, thank you so much. So at this point, please, if there are no questions, I would love the Vice President to give us the closing remarks. Miriam Frimpong.
Yeah, Frederica, please, I'm here.
Please, the vote of thanks and then the
Okay.
closing.
Okay. So please, good evening once again to us all. On behalf of all the GRASAG executives and the entire participants, I would like to say a very big thank you to our guest speaker, Dr. Joyce, for accepting our invitation and for the wonderful presentation. Your talk has really inspired us. Also, I would also like to say a very big thank you to all participants for your time and contributions. We pray and hope that we will always have you in the subsequent. Lastly, to all our executives, we say God will bless you, especially to our Women's Commissioner for the initiative. We hope to see more of them. Thank you.
Thank you so much, Miriam, for this speech. And please, I would also love to remind all of you that tomorrow we have time with the survivors. Same time, 6 to 8. I can't wait to have you all online again. Once again, Dr. Joyce, we say God bless you.
Okay, thank you. Thank you very much for having me here. I hope we get to have more talks some other time.
Sure. At this point, I would say thank you. May you all have a good night's sleep and see you tomorrow. Good night. The last person.